This is Chapter 3 of McCurnin's book. It's Veterinary Medical Records. Again, we have learning objectives for each chapter, and I just pay attention to those bolded words to help you understand what we're going to be focusing on today. The purposes of the medical record. The primary purpose is to support excellent medical care. If we don't document what is being done, then we can't follow the pet to make sure that the pet is responding normally. So it documents both procedures and communication between the people doing the procedures as well as with the client. So that's the primary purpose: excellent medical care, procedures, and communication. The secondary purpose is to support business activities like getting payment for what you're doing, supporting legal activities, supporting research. So if we can gather data about the pets that we treat, we can learn things about the diseases, about preventive care, about vaccine reactions, etc. Veterinary client-patient relationship. This is part of the medical and legal requirements. We have to have a veterinary client-patient relationship. That's a VCPR, and that exists when the veterinarian takes responsibility for clinical judgments and the client agrees to comply. The veterinarian must be personally familiar with the keeping and care of the animal, and the veterinarian has to be readily available or has arranged for emergency care and follow-up in cases of adverse reactions or treatment failure. That can simply mean that you have an outgoing message on your clinic phone that states that there is emergency care available at a local emergency veterinary hospital, and you can give the number for that. Or the veterinarian might leave their emergency phone for the client so that there's follow-up care for that pet. You always have to ask, do you have a VCPR with this pet? If you don't have a VCPR with a pet or with a client, that means that you are not going to be able to provide care, and that includes prescribing medications for the pet. There's an importance of informed consent. If you don't inform and educate your clients prior to treatment and set those expectations prior to treatment, then you're going to have an unhappy client. So that means that we have to have the malady, so identify the illness and the symptoms, have a potential diagnosis and a potential prognosis. And some of these things we may need to decide as we go along, so we'll come back to it. That goes with evaluation, reevaluation, but we have to keep the clients communicated with and educated as we go through it. We need to talk about all the treatment options, all the follow-up care, and all the emergency plans, and a justification for the treatment costs. Don't justify too much. When you justify too much for treatment costs, you make the treatment less valuable to the client. You have a treatment, it costs this much, period. We have things that we use in the procedure. We have people that we have educated and trained for this procedure, and this is what it costs for this procedure. There's no need for justification. The more you justify, the less valuable it becomes to the client. You need to document this informed consent. You have to document all of the education that you did with the client prior to the consent. You don't have to be super detailed if you do it the same way every time. If you have a written sheet, you can just say, gave them a handout on this written sheet, as long as you have some sort of documentation. So we always want to have them sign an authorization form that says that we can treat the pet, and that if there's an emergency and we can't get a hold of them, that we have their consent to treat. The consenters or the signers of this form must be 18 years old or older, and sometimes you just have to ask that question. Having a fee estimation form will let the client know what you anticipate is going to be happening. It will help you talk about the costs, and it will help them to know that your expectation is that they're going to pay for the procedure, pay for the treatment when they pick the pet up. You need to set those expectations properly because it prevents confusion and conflict later on. I don't mind knowing that I have a $400 car care bill coming up if I know ahead of time. If I walk into the mechanic and he said, "Oh yeah, I didn't call you, but it's going to be about $400," that's going to make me a little bit more upset because I haven't been able to plan for it. It's not in my head ready to go. So set those expectations early. Documentation. This protects against litigation or going to court and complaints. You want to write it down in black ink or blue ink and or type it. A lot of these go actually into a computer these days. You want to make sure all documents are signed, including credentials, your veterinarian's credentials, the date, time, and e-file. If you have a tendency to just initial your entries, then you're going to have a logbook that has your initials and your full name written out beside it so that anybody who looks at it will know who signed off on it. You need to be able to write legibly. This is very difficult for some of us veterinarians, and so that's why I really like computerized systems. But it's really important that people are able to read what you're writing in the medical document. Any tampering or inaccuracies cast doubt on the entire record, the integrity of the entire record. So if you have something that you made a mistake on, it's not a big deal. Just put a line through it and say error and then sign and date it. People need to know that there's an error. If you don't catch it, that's what puts the doubt. Ownership and release of medical information. The record is owned by the practice, not the client. Clients can have copies, and they should be able to demand copies. It's their pet. They should have that information. But you have to have an authorization from the client. A signed authorization is best. If you can get an authorization and have 2 witnesses verbally, that's fine too. If we have something going directly to another veterinarian, that may be an exception. You can mail or email copies with a cover letter. The copies may have to be charged to the client. And I have this coming up every so often just to remind you, if you didn't document it, you didn't do it. So document, document, document. There are 2 formats of veterinary medical records. One is source-oriented. The other is problem-oriented. If you are using a source-oriented medical record, it is a shorter record and it doesn't contain as much details. Problem-oriented is based on the problem. It's much easier to find the details. There is also a ability to do a combination of a source-oriented with a problem-oriented, and we'll talk about the combination. Again, if you didn't document it, you didn't do it, okay? That includes talking to clients, because clients will call up and say, well, they never told me that my dog couldn't run after surgery. Well, if you didn't put it in the medical record, then you didn't do it, even if you said it 5 times. The source-oriented veterinary medical record, it looks kind of like this. It's basically usually a card or a piece of paper, may have lines on it, may not, and it's categorized by date. So on 10/13, this dog had a splenic mass and some renal failure. On 10/19, the owner wanted an appointment to speak to B, who I assume is the doctor. On 10/20, owner decided to cancel. The dog's not doing well. So that's not a lot of information. It's a little bit of information, and if we wanted to find out what the problem was, we'd have to know exactly what date that splenic mass was found in order to go back and find it. So usually we have these source-oriented veterinary base available, so we'll have little cards that we use. The information from the sources, and we are the sources, or the doctor or different veterinary techs are the sources. They're all entered in chronological order by office visit or hospital stay. It's quick and easy to write these, but it lacks a lot of detailed documentation. But if you don't document it, you don't do it. Problem-oriented veterinary medical records are more complete. We use these with folder-type medical records. They support a very logical and organized approach to clinical medicine, and it goes through complicated medical cases one problem at a time. So you'll have a master problem list with all the problems the animal's ever had, and that works as your index. It's going to include things like a physical exam form, which is what this is. It'll include radiographs. It'll include include biopsy results. It'll include everything, and it'll be in each problem will have its own section. But if you didn't document it, you didn't do it. Some components, like I said, there are lots of things that are included in it. Client and patient information, history, physical exam findings, pertinent test results, master problem list, and the working problem list. We don't always know what's happening with a pet when they first come in, so we have a working problem list, and then when we figure out what it is, it goes to the master problem. Progress notes, assessment and plan, treatment related forms, and then case summary and discharge instructions. So everything is included in it. For the previous medical history, we want the animal's birthplace and date, their previous preventive medicine programs, vaccinations or immunizations, parasite control, dental and ear care procedures, so just preventive maintenance stuff. Their behavior, is it normal or abnormal? Or is this a dog or a cat that we have to be cautious of? Their environment, where do they live? How many pets do they live with? Any known allergies or reactions, and previous medical or surgical conditions. The recent medical history is what are they coming in for today? What's their presenting complaint, and what are the circumstances surrounding that complaint? We want to know, when we're getting this history, when was the last time the animal was normal? What are the frequency of the episodes that they're bringing the animal in, or is it something that has been constantly getting worse? What are the current medications? Any previous treatment efforts for this complaint? The owner's concerns and their comments, their current diet, and any information from a referring or previous veterinarian. This recent medical history all comes as subjective information. It's all coming in from the client or from previous history, and we call that subjective information. Here's an example of a history form that's an electronic history form. And the electronic medical records are terrific because not only can we do a problem-oriented veterinary medical record, but we can also do source-oriented. So we can do searches for the date that we treated them for certain things, or how were they feeling on this date. And we can do searches for data within this system, searching for all animals that have ever had a splenectomy, where we take the spleen out, and then look at that data in there, or when was this last animal in for a dental. So there are a lot of different things that are great about using an electronic form. This is an example of a history form on paper, where you're gathering all the pertinent information. It's nice to have forms because then you don't forget to ask certain things. And within this form, we have statement of ownership and consent, as well as the payment choice. So we're asking them to think about payment as they bring the pet in, setting those expectations. Physical examination and pertinent forms. The physical examination is very important diagnostic procedures. It's the first thing that we have to do in order to understand what's going on with a pet. Obviously, they don't speak to us, so we have to use our hands, our eyes, our ears, our nose in order to decide and determine what's going on. We may also have to do a variety of diagnostic tests and then file those tests. Physical examination and laboratory diagnostic tests, those are things that are objective information. Those are facts, they are data, those are objective information. Our master problem list, this is the defining part of the problem-oriented veterinary medical record. It's the index to the patient's medical history, and it includes major medical disorders experienced by the patient during its lifetime. So our master problem list is our diagnosis, our final diagnosis of the problem for which they came in. And this is an assessment. And so this is part of our working problem list can be a part of the assessment. Our master problem list is definitely an assessment of what's going on with a patient. Here's an example of a working problem list, and we use this to work through current problems. When an animal comes in with problem number 1, depression and lethargy, it could be a variety of things. Problem number 2 is that they have pale yellow mucous membranes. Problem number 3 on this date is mild tachycardia. So we're going to put those 3 things together as our symptoms, and we are going to do our physical exam and our diagnostic tests, and we're going to work on a master problem. On 720 and 720, we had anemia and icterus. On 724, we have a master problem list, master problem. This tells us that all of these things with our diagnostic tests led us to believe this was autoimmune hemolytic anemia, which is a disease. So that is going to be that's going to move to our master problem list. And that is an assessment. So when we are writing these records up, we tend to write it in the form of a SOAP note. SOAP is subjective, which is that patient history and the client complaint. Objective, which is the data and the facts. Assessment, which is the diagnosis or the working problem list and the diagnosis, can also be your technical assessments. And the plan. The plan is what are you planning to do in each step of the way. You may plan to do a physical examination and laboratory tests. You need to write that in the plan. You're going to write the results in the objective after you get them, but your plan starts with, I'm going to do laboratory tests. So technician SOAP notes are subjective, objective, assessment, and plan. The assessment is going to deal with the hierarchy of physiologic needs. So if they come in and they're having trouble breathing, that's a dyspnea, and that is a very strong physiologic need. We need to deal with that too, that first. Assessment can assign prioritization numbers, and that fits within our practice model, however we assess it. And then our plan includes those notations, all of the things that we're planning on doing, and also it includes our client education because they are part of the plan. And again, if you didn't document, you didn't do it. So our subjective, you usually write those as a veterinary technician, and that's kind of how the animal appears from casual observation. So that's the owner's observation and your observation. The objective, you start to do the as the technician, you start to do the objective, getting the physiologic data such as temperature, pulse, respiration, if there's vomit, urination, defecation, especially within the exam room. Any laboratory data such as blood, surgical site, the catheter placement, swelling and drainage, all of that data goes in the objective. The assessment is performed mostly by the veterinarian, although the veterinary technician, there's a box in your chapter, in chapter 3, and actually it's explained even better in chapter 19, that helps you to have very specific words to describe the symptoms that you're seeing in so you have your own technical assessments that I do encourage you to do and will encourage you to do. It helps us to determine the overall status of the patient and helps us to develop that tentative diagnosis. The plan is presented by the veterinarian, and that's the course of your action for the day and for recovery of the pet. So I'm going to have you do this activity. It's to write the following information in a SOAP format. And this is just going to get you started on how to write a SOAP note. So you're going to take this information, you're going to decide which of this information is subjective, which is objective, which is an assessment, and which is your plan. Okay? And once you've done this, I actually want you to type it out. You can write it down if you like. And scan it in, but it's best if you can type it out because then you can adjust it as I give you notes. And then I want you to upload that document into the Dropbox that I have available for you. You can look at, once you're done, once you've uploaded that to a Dropbox, an example will appear, and you can take a look at it and see what you did right, what you may have done differently. There are a lot of different ways to write SOAP notes, but there are very clear delineations between what is subjective, what is objective, what is assessment, and what is plan. And that's what we're really looking for to make sure that you get those in the right areas. Look at those things and ask questions. All right, we're going to talk about MAORs. These are Medication Administration Order Records, or award treatment sheet. So this would be something that you might find at the bottom of, or at the base of somebody's bed in a hospital. So somebody could come in, or now it's computerized, but somebody can go in and look at, okay, what are we doing with this patient today or this week? Okay, so it's the summary of the patient's hospital management, what their treatments are, the dates, the times, the doses, the routes, any cautions, what our short-term goal is, what the patient name is, all that stuff, so that we can make sure we're treating the right pet, and then a signature chart so we know who's providing the care. It's an at-a-glance summary of the patient management during their hospitalization, and there's a couple ways to do it. We can do it on the cage, but often we have a whiteboard available so that we can see what everybody needs to have done at any given time. We check those things off as we get them done. Additionally, it could be done as a computerized, so everything could be put in the computer and we can check them off as we go through each treatment plan. In order to make sure we're treating the right patient, we need to identify the patient appropriately. I don't know if you've heard, but recently there was a story of a pet. There's been a couple stories actually of a pet who've been accidentally euthanized. It was the wrong pet, given medication that euthanized the pet. So identifying pets is really important. We also don't want to give them wrong information. So just as if you were going to the hospital, they check your name every time they give you medication or ask you questions, this is what you're going to need to do with those pets. So we will have an identification card on the cage where they're staying. We may have a little sticker that says caution if we have to be careful with that pet. And then we also want to have a identification band on the pet as well. So both of those, check both of those, make sure the right patient is in the right cage and that you're treating the right pet. We might store medication on the kennel, although we don't always recommend this unless the patient is very quiet and isn't climbing on the kennel, because otherwise this will get scattered everywhere. Even cage cards and medical notes might need to be stored elsewhere because a lot of patients will reach around and tear that up. Discharge and summary forms. We need to be very clear. Remember, we're dealing with a public that doesn't always know what to do with their pet, and even if they're a medical person, like a nurse or a doctor, they often make interesting decisions about what would be appropriate to do with their pet. And so we want to be really clear with our discharge guidelines. When we do it, why we do it, what we're doing, and how we're doing it. As a technician, it's your job to demonstrate the technique, review complications, get their contact information, give them contact information, have a follow-up plan. When are we going to see the patient again? Make sure they understand community resources. If they need help, we're not here for them. What can they do? Mark the time of discharge, who we discharged to, how they transported the pet, and all of the information that we gave them. If we have brochures or handouts that we regularly give, we can store those in the computer and we can say, gave them this handout, and we'll know what we gave them. And again, if you didn't document it, you didn't do it. When we are managing paper medical records. Now, a lot of clinics, like I said, have gone to computerized records, which does make things easier. At some point, if electricity goes down, your computer system goes down, you may have to move to paper medical records. So it's really helpful to have both systems. They may not be going at the same time, but to be able to move back and forth can be helpful. Letter size folders for problem-oriented medical records. It's an 8 by 10 inch folder. It holds that medical information, usually tabs, so we can put new things in there all the time, with color-coded decals on the tabs for easy filing and retrieval. Here's some examples of some folders and some different filing systems, sometimes based on the year that they came in with their last name. Sometimes it's more complicated, where we have them categorized by year and last name a little bit differently, or they have a client number. So filing systems, there's alphabetic, so each letter is assigned a different color, so you can kind of see based on color. It's easier because you don't have a master list of clients. I'll explain that in a minute, that you have to cross-reference to, but incorrectly spelled names can be misfiled, and obviously employees have to know their alphabet. The numeric filing system is one in which each client is assigned a unique number. So you have a number that is assigned to you as a client. Each digit in the number is assigned a different color, and files are shelved from lowest to highest in numeric order. So we spot that really easily. But if we have every client has a number, then we can look up that client based on the number. Here's an example of what we're talking about, a misfiling. You can see these are color-coded in ascending order. You can see that this one is out of order, so you can see that really easily. File purging. That's a lot of files. If you have a lot of clients, a lot of files to go through. And if you have clients that don't come in for a while, you may want to purge them. So there is a process, a legal process that you have to go through, and we want to do a file purge at least once a year, where primary records are those that are active for the last 3 years. Those are going to be stored within your main filing area. We're going to put any records that have been inactive for more than 4 years or more, we're going to put those in storage. Things that have been active for more than 8 years are going to be purged and shredded. We do need to mark lost records. That's really important to make record of lost records, because that helps if we have an issue legally later on. Electronic records. There are a lot of advantages to having electronic records: fewer errors and misplaced documents, greater efficiency and convenience. You can read the doctor's writing, that's helpful. Multiple individual access, improved quality and legibility, that's the doctor's writing. Thorough, we can have templates and prompts that help us to make sure that we get everything documented. Scanning and importing key documents and images directly into their records so that we don't have large X-ray files sticking out somewhere. Needs to be validated. We do have to be careful of loss of medical records if they're electronic. The best way to do that is to store it, to save it constantly on site, and then also have an off-site location where we send the information, a cloud basically, where we send the information, have it stored off-site. Here's an example of a radiologist working MRIs or CT scans of brain, but it's just showing how we can pull some of these images directly into the medical record and pull them up anytime we have to review them. Logs. Logs are an important way to collect data as well. These are continuously updated data that serve two purposes: documentation for legal support and data for quick analysis and retrospectives. So there are a couple of places where we're going to keep logs. They may be departmental logs. So for instance, in surgery, if we have a surgical log, we can mark what surgery was done on what pet, by whom, and how long it took them. And that's going to give us a quick indication of how people are doing through surgery, what kind of surgeries we do every day, and give us an idea of how to prepare for those appointments and surgical procedures. Drug reactions are an important thing to log as well, because we need to maintain an understanding of drug reactions to see if there's a pattern so that we can communicate with the manufacturer. Unexpected deaths, those are important to log because we need to track those as well. That may be a legal issue, and so we need to make sure we're on top of that. Medical waste logs are important, and typically we have a medical waste service that actually keeps those logs for us. And then a controlled substance log is equally important. It's required by the DEA that we keep a log of all materials, all controlled substances, and the amounts that we have, the amounts that we bring in, the amounts that we give, the amounts that we throw away. One additional log that we do have to take for legal reasons, would be a radiology log, where we keep track of what x-rays we're taking and who is taking those x-rays. If you have an ambulatory practice is a practice that travels to the farm or to a house. These are sometimes kept on carbonized sheets, so they write a medical record and they give a copy to the client, and sometimes it works as an invoice as well. So one copy is given to the client and one is taken back to the office. And that information is then entered into the client's permanent record. Nowadays, we're moving to laptops and notebooks so that we have wireless transmission or synchronization of those files. Here's some examples of some ambulatory systems. Here's an old vet truck, old vet farm truck, and then here's a specialized system. This is a system where they're bringing in the information from the field and putting it into the computer system. That's what we have on medical records. Some things I definitely want you to look into. Technical assessments. I want you to look at those. I'm going to be asking you about technical assessments at some point in the next couple of semesters, and you need to know where to look for those. So technical assessments, take a look at that. You need to understand what SOAP notes are and how to write them. And you need to understand the differences between the different types of medical records. If you have any other questions, let me know when we meet in class.